Welcome to SAE Presents the Best and the Brightest. This is our second presentation. The first was with Ken Minkoff, a renowned addiction psychiatrist. But now we have something very unique. We are going to speak with Lisa Buxbaum, who is the CEO and founder of this new model of therapeutic intervention. So, Lisa, I have an initial question, and that is, what made you transition from a rather successful, normative career to one where you've become an innovator in dealing with some of the most difficult populations, and that is individuals who are generally bereft of a sense of hope and a sense of well-being, and this dominates their course of treatment. So could you begin to tell us where you came from, what made you change, and what is your motivation here?
Absolutely. First, I just want to say, though, Stephen, that it's such an honor and privilege to be here with you because we're really all standing on the shoulders of your vision to treat individuals with behavioral health issues or mental health challenges or substance issues with the dignity and respect that they deserve, not demeaning them, medicating them so they can't function, like just really recognizing the whole individual. My journey is like many not-for-profit founders. I was motivated by personal experience, which led me to solve several unmet challenges. There were 3 experiences with death and illness that happened in my family in a 10-month period. My only sibling died suddenly of an asthma-induced heart attack, and I got the phone call at 4 o'clock in the morning, and he hadn't been ill. And then 5 weeks later, my father had his second bout of non-Hodgkin's lymphoma, the worst kind, the worst stage, and he was hospitalized for 4 long weeks. And during that experience, my mother and I made signs and messages and contests on the oncology stem cell floor at Columbia Presbyterian Hospital. All of the men and women washing the floors, bringing the food, the PAs, the doctors, the nurses, the family members, and the patients would come to Charlie's room every day. He was in contact isolation, but he could look through the window and wave to people. And every day they would come to laugh, forget about their problems for a few minutes, and to be part of a connected community. And what I learned from this experience at the bottom of the bottom in our family was that when people have a sense of hope and when people feel less isolated, it really can create inflection points and room for positivity and room for hope. 10 months after my brother died, my oldest son, who was 8 years old at the time, became catastrophically ill. He had strep throat. It became rheumatic fever. He was twitching and drooling and heavily medicated for 4 months. And the head of neurology, he said, "Mr. and Mrs. Buxbaum, go be by the sea." Now, as you know, Manhattan is an island surrounded by water, but he didn't mean that we should take our child and go hang out on the West Side Highway. So we actually moved 12 miles away from where we lived, and someone gave us a cottage, and we lived there in the Rockaways. So every morning I would walk along the beach crying, praying, singing, because the rest of the time my son needed my full attention. I had become a sudden caregiver. And during those morning walks, that was the only time to just let it out, because I would sleep in his bed and massage his tired limbs because he was having cramps and seizures and help him go back to sleep. And on one of those morning walks, the name and the feeling, Soaringwords, came to me from above. And I saw my life in front of me. And I knew that I could create all of these things that these families so desperately needed. So at the one hand, when my family's world imploded, I thought that I had become irrevocably damaged. But instead, it led to a calling, which I've pursued for the last 25 years. So that was the start of my journey.
So how did this, what I would call spiritual experience, get translated into a disciplined protocol? What did you have to go through to make it a protocol that could be tested, evaluated. It's quite a transformation from a spiritual role to one of being, in effect, a behavioral health scientist bent on showing that your approach had validity and reliability in terms of impact on patients.
Sure. So my first career was in marketing and advertising. I have an MBA from Columbia University, and I was really happy selling Colgate toothpaste and all these other internationally renowned brands. And then I ran my own award-winning marketing communications firm for 11 years. And then when this epiphany happened in our family, I just shifted gears. It was after 9/11. It was in the early aughts, and people were saying that New York City was going to become a ghost town. And I just thought, I'm young and I'm going to start. So I started working on the business plan. And because I was a businesswoman and because I was an entrepreneur, I knew that it wasn't just buy people red balloons and they'll be happy. There had to be some real substance to that. So I assembled an advisory board of the leading experts in medicine, in religion, in education, in spirituality, and in mind body wellness, healing modalities. And before I knew it, I had 70 people who were really accomplished in the way that you're really accomplished. And again, it wasn't just people saying, this is great. It was people saying, I must be part of this because there's a real need here. To give people a sense of agency, to give people a sense of hope, to take the power or authority away from the man or the woman in the white coat and say to an individual or to a family constellation, there are things you can do so that you don't have to suffer so much. There are things that you can do so that you can feel more expansive, even though it feels like your world is crumbling because of a medical crisis. So the way that we started, I'm a visionary, I'm a person of great passion and great action. So we started going to 2 of the leading hospitals in New York City and create programs that were highly immersive and highly emotionally satisfying, fun, meaningful, and a few things that I didn't realize at the time were extraordinary or really weird or unusual were I didn't want to just give the kids and the families and the hospitals teddy bears and video games. There's nothing wrong with that, but that just is giving them something and they're passive and they accept it. What I wanted to build into all of our interventions and our programs was a real sense of immersion, a real sense of creativity and individuality. From the beginning, we would go in and do different workshops, different programs. And at the end of the program, whether that was the little children or the teens in the behavioral health units who were experiencing suicidality or were cutting themselves, or if it was the patients of all ages in burn units, if it was the moms and dads who wouldn't leave the neonatal intensive care unit because their baby was born 2 or 3 months early and this was not what they expected and they were crushed, or the nurses or the doctors, the people that were really carrying the heavy load of being these healthcare professionals. Everything that we created, there was a piece that I was appealing to them as the person, the individual, the chief nursing officer, the charge nurse, the PA, the mom, the dad, the kid. But I was also appealing to the staff in their professional role to explain to them how taking the 10 minutes to do this alongside their patients, alongside the family members, would instantly create these deep bonds of joy, meaning, and humanity. And then it became a positive contagion that instead of everyone feeling gloom and doom, we were giving them these activities, micro interventions as they were, that were creating a major paradigm shift physically, emotionally, and mentally. And then after doing 2 hospitals, we grew to 10. We started going to different cities. I started working with corporations. JP Morgan wanted to do an employee engagement program in 2 cities and then 10 cities, or Johnson & Johnson wanted to do an employee engagement program in their headquarters in New Jersey, and then 10 countries. So everything just kept growing because people are people. So it doesn't matter, again, what your title is if you have a job, whether you're cleaning the floors in the hospital, which is a famous Jane Dutton positive psychology study where they interviewed hundreds and hundreds of janitorial staff in leading hospitals. And they found that the men and women who felt there was a sense of meaning, there was a sense that they could contribute something in their profession, those people had better health outcomes. Half of the population said, I have one of the most important jobs in the hospital because I go room to room and I spend so much time with the families and the patients. And that gives them dignity and that gives me purpose. And the other janitors were complaining, rightly so. I have to deal with these smelly chemicals and my back hurts and I'm tired and no one respects me. Same job, different way to approach it. So what we've always baked into our Soaring Words well-being model was to treat each person with dignity and respect, to give them a sense of agency and purpose and action, and to really mean it, because there's a difference between authenticity and programs or initiatives that are shoved down people's throats or created by the people at the top, but don't really take into account the reality of people with medical challenges or setbacks. So just really going and doing and seeing and making modifications. We also started working with municipalities on a systems level. So our first city was the Jersey City Department of Health and Human Services, and they were serving 270,000 residents in Jersey City. After doing this for several years, working with thousands and then hundreds of thousands of individuals and families and healthcare professionals in hospitals, we turned our attention towards social service agencies. And we started working with them in different cities and then in different networks nationwide. I met the people who run the Jersey City Health and Human Service Organization, which was really doing innovative things to serve the 270,000 residents of Jersey City. At the time, Jersey City had the distinction of being the most diverse city in North America. And in many ways, it was a tale of two cities. A lot of the banks and investment banking community in New York City had put their back offices in Jersey City. So we had a lot of professionals who were living in these sparkling, beautiful new apartment buildings and complexes. And then you had the most diverse city in North America with many different ethnicities and dialects and people who were new immigrants or people who were living with a lot of social determinants of health. So Jersey City hired me to come in and lead workshops for all of their staff. And some of those people had PhDs, and many of those people didn't have formal education, but they were considered the de facto leaders in their community. And then we brought in the residents. And when we were doing this, the World Economic Forum awarded Jersey City the Global Healthy Cities Initiative, an enormous honor. And Soaringwords was honored to lead all the workshops for that initiative. So those are kind of the early days of how we got started. And in 2011, I discovered the field of positive psychology. Dr. Martin Seligman is the founder of the field of positive psychology. And I discovered his book, Flourishing. I applied for this Master's of Applied Positive Psychology program. Even though I had been doing Soaring Words for 11 years, I felt if I went back and got all of the scientific rigor so that we could empirically measure everything that we were doing, then it would really distinguish us even further. I didn't need to do that because parents and nurses and doctors and professionals were telling me, that's the first time we've seen that patient smile in 2 days, or that's the first time that we're able to reduce their pain medication, or that's the first time that they started talking about other people in a hopeful way. Because as I said earlier, all of the interventions were highly immersive, and we had people doing things as a pay it forward at the end of every activity.
Lisa, as you talk, the variety of what you've done is amazing. And my question is, throughout this journey, were there specific initiatives or specific defined interventions that you accumulated that you could take from one population or one task to another. The reason I'm asking this is what you're describing leads me to think there must be certain clinical and certain interventions that can be applied through different communities that supports the application of soaring word. You know, if I was an agency and I said, this sounds interesting. I'm running a program for elderly people who are not quite ready for a nursing home, maybe in a more independent setting, and they're worried, they're uncomfortable. And the message I'm getting from you is a message of hope. So what might be the protocols that you've learned, the interventions that you've learned that you carry from one sector to another?
So let me just tell you what the big inflection point was, other than having the epiphany and the calling and changing the trajectory of my career and the rest of my life. Another big inflection point was when COVID happened. I was actually leading an in-person workshop in Jersey City the night that it was announced that the country was clocking down. And I realized driving back to New York City from Jersey City that I was probably not going to be leading any in-person workshops or programs for a while. And then I realized that we were not going to be walking back into all these hospitals that had really embedded our programs into their patient care and their staff well-being programs. So I was swimming and walking in Central Park with a mask and praying and saying to my board, what are we going to do? And then it became so obvious that the people who were most impacted adversely during COVID were older people. And then Dr. Vivek Murthy, our wonderful former Surgeon General, started talking about the pandemic of isolation and loneliness. And it just was so obvious that all the workshops and programs we had done with children in second grade and elementary school and college and grand rounds, doing it with doctors, that all of that could be tweaked, could be modified, or not really that much, to work with a senior population. So right now, the population going forward in the next 20 years, there's an explosive movement to over 65, over 70. That's where all the growth is. So it's also well poised from a point of view that there aren't a lot of programs in place as people are aging. So we have programs now, workshops that really resonate with this population. So what we did was we spent 16 months researching 7 workshops, which are based on the Soaring into Positive Wellbeing workshop model, which conveniently stands for SOARING. Strengths, shifting one's mindset, one's body, looking at relationships has a positive and direct impact on overall well-being. That's optimism, choosing to look at the good even when times are difficult or painful, and with the hopeful expectation that things will be good in the future. Altruism, this notion of building community by giving to others without any expectation of return. Resilience, bouncing forward through challenges. And then imagery, the healing power through self-reflection. And then narrative, sharing the power of positive storytelling and how we look at ourselves and teaching people how to be the hero or heroine of their life story. And then lastly, gratitude, one of the most powerful of the positive emotions, helping people really embody how to notice and appreciate good things all around them. So I took this model that we had created. It was actually my master's thesis that was SOAR, SOAR, and then I just kept adding more because more was needed. So we created these 7 workshops. We got a producer from the Today Show to come in and film them. And then I had remembered that the Department of Health had special budgets because many of the communities were doing not so great things that were really impacting resident well-being in a very adverse way. We started the pilot program in 2023, early 2024, where we got funding to go into 26 skilled nursing communities in New Jersey. If you had said to me, Lisa, what do you want to accomplish? I would have said, we have a pre-survey, we have a post-survey, everything's empirically measured. If 25% of those individuals, the residents and the staff, if they say, I feel stronger, I feel that I'm learning new things, I'm curious, I'm not at the end of my rope, I'm alive, I'm moving, I'm growing, I feel more agentic, I feel stronger, feel more confident. 25% were stronger, 25% said they're learning new things. If 25% said, I feel a sense of connection, community, and belonging, I would have been thrilled. But instead, the numbers, the data were much more powerful. 95% of people said they discovered and they were using their strengths. And 93% of the participants, this is thousands of people, said, I'm curious again, I'm learning new things, having so much sense of confidence and meaning and joy. And then 91% said they felt a sense of connection and community and belonging. And we have some testimonials of real people in these situations where they talk about what the workshops meant to them. And when we had our quarterly meetings with the Department of Health and we actually showed these videos to them, I'm proud to say, because people are people, we're not robots, they all got a little misty-eyed. And then I paused our meeting, which was very formal and very government, and I said, tell me, each one of you, how you feel about this. And they spoke about the pride and the joy that they were able to fund something that was really changing people's lives. Because at the end of the day, if people are bereft of hope and people feel shame and people feel just that they're meaningless, then the chance of recovery is pretty slim to none. But by giving them tools, like real skills that are based on the latest scientific discoveries, then they're invited to take what we call an active role in their self-healing. So none of us can do these things alone, but working with healthcare professionals who have compassion and have empathy and have skills and have devoted their careers to helping people and then giving the people the tools that they can see a path forward, it's been so rewarding and powerful because, not to boast, but the results have been pretty astonishing.
You
And
know what this brings to mind with me? For a period of time, I administered, supervised, ran several state hospital units. And I did acute care, I did intermediate care, and then I did long-term care units. I was called in often to refit them. And one of the principles was the principle of a therapeutic community, which was to get patients involved. Had I had this tool then, this would have been a great precipitant for getting patients much more involved on their lives on the ward. And why is this important? Because I discovered very quickly on long-term care units, patients vegetate if they're not motivated. And one of the approaches with therapeutic community is to work with the staff. If you change the staff's approach to working with the patients, you can change the patient's outlook, motivate them, generate positive therapeutic activity, and show marked improvement. So I hear what you're saying.
so I think everyone knows about the Suffering Olympics. There's a notion called appreciative inquiry, where instead of having them engage in that downward spiral, we have a lot of interactive prompts in each of the workshops and the programs that we do so that no one is passive. And then I train the staff because they know and love the people that they're caring for, and I can't be in 10 time zones at the same time. I've created this as a legacy program that's much larger than me and my team, so that I do all the workshops on Zoom with the people in the social service agencies and the long-term care and the assisted living. And then they go and they do it with behavioral health units or memory care units or stroke victims. And they feel so confident because they've gone through it themselves. So my mission, our mission for the past 25 years was to inspire individuals and healthcare professionals to take active roles in their self-healing so that they could experience greater physical, emotional, and mental well-being. And now that I'm focusing on senior populations and aging, but also behavioral health and mental health and substance usage, I want to destigmatize the shame of people who are differently abled and neurologically divergent, because that's really an archaic way of looking at the world. We're all neurologically divergent. The way my brain works is different than yours and is different than other people who might be suffering more because of the way their brains work, but it doesn't mean they're less than. What really we are focused on doing is spreading the word. We are expanding to 100 more communities in New Jersey. The state of Florida wants us to spread this far and wide with 200 communities there. I've been invited to give keynote talks at different conferences, but really for anyone who's listening, if anything that I'm talking about resonates with you, I would really welcome the opportunity to meet with you and explore how we can inspire all of your staff and all of the individuals that you care for to really feel that they're not alone, that there's meaning in their life, that they matter, and that there can be joy, even though they might be going through significant hardship. And that's what motivates me to wake up every morning. You know, my head hits the pillow at night, I'm out, I go to the gym, I swim every morning, but then I just want to help as many people as possible. And we've already helped 500,000 individuals and families, but I do feel in many ways that I'm just getting started.
Permit me to suggest that we will monitor the response to this presentation, that if they have a sense that you could be helpful, depending on what level of care they're dealing with, what the nature of the care is, send a request to me and we will filter it to you so that you could be an asset, so that this presentation is not a passive one in a sense. This is my takeaway from this. This is what I take from what you're saying. So that I'm going to ask people listening to this, if they're working with a population that they feel somewhat stymied, that they feel they need to be, for want of another word, energized, refreshed. If they were struggling with, how can I energize? How can I engage a patient better? Have them send a request to us and we will pass it on to you. Because what I'm picking up is you have a variety of interventions for patients of a different level and staff's needs of different levels. So if we could acquire a profile, we will send that request directly to you.
And in addition to being energized, what I've learned in the past 25 years of doing this is that people need to be seen and heard and validated. That's really important. And, you know, there's a lot of scientific white papers about when radiologists see a photo of the patient, they're 20 or 30% more accurate in their reading because it's not just a scan, it's a human being. So all of these things that I've devoted the past 25 years to are based on science, but they're also based on common sense. And this notion that when you are working in a healing profession, you have to recognize the whole person, not just the presenting symptoms. It's George who has a life and has an identity and is a person. So I'm always very aware of that, and that informs a lot of what we do.
On that note, I have enjoyed what you're saying, but I also have a feeling we're going to get a response to this. And I pledge we will pass this on to you because what you've said has tremendous value in a non-traditional, non-clinical way, but in a much more feeling, empathic, person-to-person approach.
And I just want to say to everyone listening, thank you. And I'm sending you strength and love because, what you're doing is so needed and so necessary. And it's just really important to fortify yourself as well. Self-care is healthcare, and to take that time to refresh yourself so that you can continue on in your important work. So thank you, Stephen, and everyone at SAE.
Bye-bye.